I'm here with co-founder and medical director of LifeWorks Wellness Centers, Dr. David Minkoff. It's such a pleasure to have you here.
Thank you, thank you. Good to be here.
So we don't have a whole lot of time, but tell me real quick about your world-renowned clinic. I mean, try and do that.
Okay, well, it's true. We have people come from all over the world. I had a new person from Australia yesterday, someone from Norway, someone from Hawaii. So we're seeing people from all over the world because we offer services that really you will hardly never find in one place.
Sure.
I've collected all these things because I'm driven by trying to help people get better. And sometimes it takes 5 or 6 different things in order to do that. So we do very precise diagnostics like what is wrong with this person.
Okay.
You know, most people who get sick 5 years before they were fine or 10 years before they were fine. This isn't kind of a genetic problem. They were healthy, their body was functioning, but their body got ill because they got too many things in it which weren't good, and oftentimes people's nutrition is not adequate and they're missing things. Their vitamin D is low, or their selenium is low, or their zinc is low. So what we found is if we can find what are the things that are affecting their body in the way of toxins and infections,
Sure.
and what are they missing, that if we can put this together, get the bad things out and the good things in, that the body's programmed to heal, and it will heal and get better.
So you started with traditional medicine and have grown now this incredible wellness center to really the world's leading, you could say, leading authority on or alternative medicine. So tell me about Lyme disease. It's not something that's like fresh on the radar, but all of a sudden we are hearing more and more about it. Why is that?
Well, infectious disease, my training was originally in pediatrics, and then I did a specialty in infectious diseases. So in the early 80s, I worked in hospitals. There was the AIDS epidemic had started then, and we saw all these people that had very complex infections that nobody understood. So I've worked in a traditional infectious disease setting, and I did that for a long time. I was a hospital infectious disease specialist. Infectious disease cycle. You know, there are periods when they're very prevalent, and there are periods where they go down. And we are now in a pretty much a world epidemic of Lyme disease. Now, Lyme disease is caused traditionally, the traditional thinking on it is that you have to have a certain type of tick, get a bite, and that tick passes on to you a single organism, and that organism infects you. What we're finding today is that these things can be passed by more than ticks, probably any biting insect, so there's lots of mosquitoes around here, people can get it. It used to be said that people, when you got bit by the tick, you got a certain kind of rash, a bullseye rash, you may feel fluey, and then you could get treated with antibiotics and you could be cured. What we're seeing now, and probably 90% of the people I see, never realized they had a tick bite, or they've had tick bites for years, but they didn't get the bullseye rash, they didn't get the prodrome, they didn't even know that they were infected. And then months to years later, they start to get sicker and sicker. They get loss of energy, they may get arthritis, they may get brain fog, they may just not feel well, and they often come in not really diagnosed with Lyme, because most traditional infectious disease doctors are doing a blood test for Lyme, and in many people we find it is not positive. It just isn't a good enough test to say, yes, you have it, and or no, you don't.
Wow. So in many cases, is it fair to say they're being even misdiagnosed in those early years, even with other diseases? And
100%. 100%.
So what are you seeing with your patients in that?
Well, most of the people we see have been down the road. I think the average person that we see has been to 14 different physicians, all of whom are competent, but they're not looking at this quite the right way. You know, you can get very focused on here's what we look at and here's what we do. And the analogy I tell patients is, hey, how many bacteria do you see in my hand? Okay? None, because you don't have the right tool. But if you have the right tools, you can say, you put this under a microscope or magnify it a couple hundred times, you'll see that there are thousands, maybe millions of bacteria here. And it's the same with Lyme disease. This disease exists. The organism has been around since Egyptian times at least. Like the Egyptian mummies, they have found Lyme bacteria on there.
Wow.
So this has been around. It's a very crafty organism. It knows how to hide. It knows how to suppress the immune system. It knows how to change its form. so that the body doesn't see it. It can produce what are called biofilms. They form a kind of a mucus protein coat so the immune system doesn't see them. When people take antibiotics, they don't get through the biofilm, so they don't get cured from it.
Sure.
So what we've done is to work out a whole bunch of different ways to get at this thing, find out, number one, that it is actually really there, and number two, how can you break through the biofilms, get the right medicine in the tissues so you can handle the problem.
Good stuff, Dr. Minkoff.
Okay.
What would you like to leave our viewers with? Any final messages?
I think if you're undiagnosed, if you have an autoimmune disease, if you have chronic fatigue, if your doctor told you that you're just menopausal or you're depressed or you're going through a midlife crisis, but you know you're sick, that you probably are, and you just need to find someone who can figure out what is actually wrong with you, treat you so that you can get better.